Good morning. I have a very special guest with me today, and I'm excited to have him on our podcast this morning. I have Dr. Irwin Isaacs out of Albuquerque, New Mexico, and he's going to be talking to us today about regenerative medicine and how it works. And so, Dr. Isaacs, before we get started with our interview, would you just like to take a quick moment and tell us a little bit about yourself and your clinic and how you became involved in regenerative medicine?
Thank you, Christy, and good morning. I initially did a anesthesiology residency and did a pain fellowship after that. I have been practicing interventional pain for over 16 years. I have been performing injections for musculoskeletal and nerve pain. I started getting involved in regenerative medicine about 3 years ago. I was very excited to see the results that it produced compared to the other interventions that I had done previously using steroids. I am now performing platelet-rich plasma injections for joints and for aesthetics. I'm involved in performing Botox injections, dermal fillers, PRP, microneedling, and hair restoration. I believe regenerative medicine is here to stay and is going to produce excellent results in areas where we have failed in the past.
Wow, great. That's really interesting. Thank you so much for that. I think probably now's a great time to just start to dive right in and answer the question, really, what is regenerative medicine? We hear a lot out there about stem cell therapy and PRP and a lot of different terms, but really, what is regenerative medicine as a whole, as you would define it?
To be regenerative medicine implies using a person's own platelets or stem cells that are derived from their bone marrow or fatty tissue. In some cases, we use growth factors from other tissues. And what these involved is they stimulate the tissue healing and by using the growth factors that are in the stem cells and platelets. So areas that are injured, there is damage or inflammation, and these cells activate the damaged cells to switch into repair mode. Stem cells produce a large number of cell signals that can coordinate and stimulate tissue healing.
Oh, fantastic. So it sounds like what we've been talking about here is where we actually are using our own body's platelets and stem cells. But, what if I have a blood condition or I am not able to have you actually harvest the stem cells or the platelets from me? Are there any other options out there available for patients that might have a medical condition that would prohibit them from using their own cells?
Yes, there are several options available. Amniotic membrane and amniotic fluid contain a very large number of human growth factors. During childbirth, instead of tossing the placenta or umbilical cord into the garbage, mothers can use to donate these tissues once they understand they're helping other people to heal from degenerative conditions or other diseases that they may have. Of course, the companies that prepare these tissue or amniotic fluid test it in order to ensure the tissue is pure and sterile. Placental tissue and umbilical cord blood stem cells do not cause rejection when used to treat other people.
Wow, that's really interesting. It does make sense that this would be a very refined process, obviously developed for human use, and I'm sure there's some significant testing that it has to go through. So we've heard a little bit about the products. Now, let's find out a little bit more about the conditions that are most commonly treated.
So regenerative medicine is used to treat different arthritic conditions such as knee pain, hip pain, shoulder pain. In conditions where there is a partial rotator cuff tear, the platelet-rich plasma works really excellent to repair that muscle. You can also inject it for tendonitis, muscle tear, tendon tear, lateral epicondylitis, plantar fasciitis, and spine pain. There are testing it on a lot of different joints and have found it to be quite successful.
Wow, okay. Well, previously you mentioned something about facial aesthetics. So is there also an application for this to be used in the aesthetics or skincare space?
Yes, the platelets are excellent for rejuvenating the facial skin, and this is done by a process called microneedling.
All right. Well, but I have a question about microneedling, but I also had written down as you were talking about hair restoration. Can you tell us a little bit about how platelets and stem cells might stimulate hair regrowth?
Well, what it does is you use a microneedling pen to generate these micropores into the skin. And when you're using it on the face, it causes more rejuvenation of the skin by laying down more collagen and reducing the wrinkle effect. As far as the hair restoration, what it does, it makes the follicle stronger and the hair growth stronger. So that's how it works, is by promoting healing of the hair follicles and regenerating the hair growth.
Wow, that's really amazing. Thank you for sharing that. So I know that you have talked quite a bit about microneedling. So I think now would be a good time to maybe go over that process. What is involved with microneedling?
So microneedling is using a special kind of pen that has very tiny needles in it. And what you do is you apply that microneedling pen to the skin, and it makes these tiny little micropores all over. And what that does is stimulates the skin into producing more collagen and elastin in that area. And on top of that, you apply the platelet-rich plasma, and it increases the effect of rejuvenation and wrinkle reducing. And it is excellent and is one of the best natural creams a person could want for their face. And the skin looks really younger.
Well, I know I could certainly use a little bit of that. That's excellent. That's excellent. I'll certainly be needing to get trying that very soon. So, okay, so you do a wide variety of procedures in your office, from spine injections to musculoskeletal injections to aesthetics. But do we need to take time off for these procedures? Is there any downtime for these types of treatments?
Uh, Not really. Most patients can return to work the same day or the next day. These procedures are done in a very precise way using a portable X-ray called fluoroscopy or ultrasound. So we do these procedures accurately. We also have a special centrifuge that produces the platelets 8 to 10 times the concentration of your blood. And it's very critical that all these things be used so the patient can get the best results.
Well, that's very good information. Certainly, as specific as this treatment is, you'd want to go to a professional that has been trained well and does understand the process. So that's very good information. Thank you. And the fact that you're going to turn the next day is marvelous news for a lot of patients out there, that they could, rather than having surgery, or even a surgery where they're trying to diagnose something, this might be something where they could have an option to have this done beforehand with no downtime. So that's fantastic. So I'm sure there's, as people are listening, there's a question about, about insurance. What is insurance, or how does insurance feel about these therapies?
Most of the insurances do not cover these therapies. However, when patients consider their deductibles, out-of-pocket co-pays, time lost from work, this is a very affordable option. This type of medicine is personalized to provide the best outcomes and long-term healing results. I really believe in regenerative medicine as the best thing that has come along after a long time.
Well, that's fantastic. I know my family, we certainly have a very large deductible, and personally, really, most all procedures for me would be a cash procedure unless something very major happened, and hopefully that never does. But so if I was spending my own money, I'd much rather spend it on something my physician had recommended that it would heal and provide more long-term results versus just kind of a band-aid, so to speak. So that's wonderful news, actually. Um, so in your clinic, do you have any current specials going on that are happening in your clinic? Do you have anything exciting that's happening in your clinic right now that our listeners might be interested in hearing about?
Currently, I'm offering a 20% discount in August um, for patients that are needing regenerative procedures such as platelet-rich plasma injections for joints, uh, tendons, as well as aesthetics. So they will get 20% off for facial PRP procedure, Botox, as well as dermal fillers. So this is a great time to take advantage of this special, and people can see how good it works for them.
Oh, fantastic. Everyone loves a special for sure. So if they are interested in taking advantage of this special, how would they find you? How would they make an appointment with your office?
So they need to call my clinic, and the phone number for that is 505 503 6990. The name of the clinic is PRP, Regenerative Pain Institute. Address is 4163 Montgomery Boulevard, Northeast Albuquerque. Zip code is 87109.
All right. So I'm just going to repeat that for our listeners. So the phone number to call the office is 505 503 6990. And I'm sure that any one of his staff members, Dr. Isaac's staff members, will be able to answer any questions that you might have. And then their clinic is located at 4163 Montgomery Boulevard, Northeast Albuquerque. And I believe you're also out there on the web. I was able to pull your website up while we were visiting today. And your website is prppaininstitute.com. Again, that's prppaininstitute.com. And you can also find Dr. Isaacs on Facebook at Regen Wellness Doctor. Go out there and like his page. It looks like he's got the special out there where you can take advantage of your 20% coupon and download that, and he'll make sure that they honor that when you come into the clinic. Again, that Facebook page is Regen Wellness Doctor, and to receive the special offering that he has, which is a 20% off, it sounds like all services regarding regenerative medicine and aesthetics. That's a great deal, Dr. Isaacs. So is there anything in closing that you'd like to mention to our listeners today?
I just feel like this is one of the best treatments for joint pain, tendon tears, as well as facial PRP, microneedling, and I'm really excited about taking care of people that would want to have this therapy. Thank you.
Oh, you're very welcome. Well, thank you so much for being on our show today. We look forward to re-interviewing you down the road and see how things are going in Northeast Albuquerque. Dr. Isaacs, again, thank you so much for your expertise and your advice. I'm sure a lot of patients are going to be very interested in the services that you have to offer, and this information was very, very helpful. We wish everyone to have a very, very good day, and we look forward to having you listen in on the future podcasts. Thank you so much and have a super week.
Thank you very much.